All right. Good morning, everyone. Thank you so much for joining us. My name is Candace Boutel. I'm with Inspire Wisconsin, and we're really excited to have you on our session today as we talk about different types of therapy in a rural location. So we're going to learn a little bit more about where that is and what that means. What I would love to do first is to have any students, if you'd want to just drop in the chat where you are listening in from. We'd love to know where you're tuning in from. So just drop that right in the chat. And as we are going through our session today, I really want to encourage you to enter any questions that you have in the chat. So you can throw them in there right away off the bat, or as we're having the conversation, you certainly can please enter those questions, and I will make sure that I'm watching the chat and weave those into the conversation. So we have one student from Oostburg. Welcome. Excited to have you here. And Nina, awesome. Welcome. Well, thank you very much for tuning in. I think our healthcare sessions are always extremely popular. I'm going to make sure I can keep track of our waiting room as well. We have more students that are going to be joining us here. But the healthcare sessions, I think, are always really popular, the virtual career events, because number one, I know it's a challenge students to be trying to organize any in-person experiences. If you're looking to do job shadows and things like that, I know that those can be limited these days, obviously living in the COVID world. So tuning in and learning more about the careers available to you is such a great way to learn about possible healthcare careers. And I hope that you've been noticing there's really so many avenues that you can go down. So lots to learn about today. Today, we're going to be talking about different types of therapy and rehabilitation. And our guest today is Kelly Kinchy. And she is a speech and language pathologist, and she's also the rehab manager. So I'm just going to jump right into our conversation and welcome Kelly. And if you want to just tell us a little bit about yourself and a little bit about what your role is, and then maybe tell us about your organization and where you work.
Perfect. Welcome. My name is Kelly, and I am, as Candace said, I'm a speech and language pathologist. I've been an SLP, or sometimes called a speech therapist. This spring, it will be 20 years. I graduated from college in 2002. To be a speech language pathologist, it is a program that you have to have a master's degree before you can do any treatment. So it's an undergraduate degree in communicative disorders, and then you go on to get your master's degree either in speech language pathology or you could do audiology. And I obviously chose the speech language pathology route. After that, you have a 9-month clinical fellowship year. They call it a year. It's really 9 months. After that, you are able to practice as long as you pass your boards and you become certified with the state and then also a national certification. So there is a lot of education and quite a few hoops to jump through, but I found it to be a really excellent career. There's so many different pathways that you can take, so many different avenues that you can work in so many different environments. So I work with adults and predominantly in a neuro background. So I work with patients that have had a stroke, traumatic brain injury. Maybe they've had a brain tumor removed. They could have a neurodegenerative disease like ALS or muscular sclerosis, Parkinson's disease. So that's the predominant group that I work with, mainly geriatrics. So I would say the majority of my patients are over 65, but later this week, I have a 18-year-old that I'm working with that had a traumatic brain injury after a motorcycle accident. So that is the background that I come from. I did my education at UW-Madison for both my undergraduate and my graduate. For speech language pathology, they're actually one of the best schools in the nation and in the world. So it's nice that that's right here in Wisconsin and in-state tuition. So that was all good. And where I ended up is here at Edgerton Hospital. Edgerton, Wisconsin is about a half an hour from Madison, about a half an hour from Janesville. We are a small community and we have a community-based hospital. We are considered a critical access hospital, which means that we have a limited amount of beds. We're an 18-bed facility, and it also means that we try to keep our patients here as much as possible so they can have their treatment and their rehab close to their home in their community. But when needed, obviously, we do refer patients out to larger hospitals in typically Madison and the Janesville area. Patients that come to us can come to us for inpatient care. They can come to us for rehab, and I am the manager of that rehab department. We have about 10 staff that are full-time or here regularly. 6 of those staff are PTs, 2 are occupational therapists, and then 2 are speech therapists. And we see everyone. Kind of when you work in rural America, you're a bit of a generalist. You have to do a little bit of everything. So we see inpatients, we see outpatients, and we see our swing bed rehab patients who stay with us for weeks to sometimes over a month to get therapy almost daily so that they can get back home. So that is a little bit about Edgerton Hospital and about speech language pathology. And I'm excited to be here and answer any questions you may have.
That sounds great. And just a reminder, students, to go ahead and type those specific questions that you might have that you'd really like to learn, something you'd like to take away from this session today. And I'd like to, I think, dig into a little bit deeper into the different types of therapy. So with your background as a speech therapist, you mentioned the audiology, and then you talked about kind of your clientele that you mainly work with older adults. What other avenues could a speech therapist or speech and language pathologist go down, and what types of environments might they work in?
Definitely. So I think it's either one or two ways. Speech language pathologists either go into the schools or they go medical model. So there is a large percent of speech language pathologists that work in elementary schools, middle schools, high schools. And I would say, gosh, that's probably 75% of speech language pathologists go down that route, maybe a little bit less. But a lot of us, when we're in graduate school, decide that maybe we want to go more into a medical model. And initially, I was going to school to become a nurse. So I kind of liked that medical environment. So I knew that that would be the calling for me. When you go into the medical model of speech language pathology, you can work in a hospital, you can work in an outpatient setting, you can work in home health, you could work in a skilled nursing facility, and some even start up their own private practice. So there's a lot of different avenues that you can take. In my career, I worked at UW Hospital, which was a level 1 trauma facility. So we saw patients that were very, very ill and very, very acutely injured. To most recently, before taking this position, I worked in home health. So I traveled to people's homes and I saw them right in their home, which I found very functional, very helpful, and probably the most fulfilling part of the job that I've ever had. So there's so many different avenues. You will never get bored. There's endless opportunities for growth, and you can work in so many different environments all within the same career. That eventually you can even go into management, which kind of takes things to a whole different level.
Oh yeah, that's a really good point. And I'd like to touch on that in just a minute. I wanted to ask quickly though about the program that you did. So the master's program, are the master's programs pretty highly competitive? It sounds like there's a high need for this type of, expertise. Is it difficult to get into the master's programs, and are there a lot available within the state?
It is difficult to get into some of the master's programs. I would say UW-Madison, even like undergrad, it's very competitive. It was even competitive 20 years ago when I was going into graduate school. So yes, but there are a lot of other programs within the country and within the state that are less competitive and have less of an academic approach and more of a clinically based approach, which I also think can be just as good as going to one of the larger universities. I am going to have a graduate student with me starting in January, and she's going to be with me from January to May. And she's a graduate student at UW Whitewater, which is just about 15 minutes from here. And she is going to be with me for the semester, learning the ropes of being an SLP in a medical setting, as that's something she thinks she wants to do down the road. So that's the great part of graduate school, is you get to try out different things. You also have a practicum in a school, so you can kind of feel out what you think might be best for you. I would say it's competitive, but it's definitely attainable.
Awesome. And that was the other thing I was thinking was that fellowship that you mentioned. Do students have to find their own placements? Is there a process that they go through to attain that clinical experience?
So within graduate school, there will be someone within your graduate school that will help you get your placements within graduate school. The clinical fellowship year is actually a paid position. It's kind of like a paid internship. It's typically, it only needs to be 9 months, but sometimes there's programs that go for a full year. So UW Hospital has some rotating full year clinical fellowship year positions. And those are nice because you can get your foot in the door and kind of experience a opportunity to work somewhere that you can as a CFY or a clinical fellow that maybe you couldn't get into as a new grad, but it would give you that experience that you can put on your resume. And that is something that you apply for. And usually when you're looking for jobs, it will say CFY okay or willing to hire CFYs. So they know that they're willing to have someone pretty new. But I would say in those positions, it's good to find a really good position somewhere where you'll have support and you'll have a good mentor there to help you.
Definitely. I'm sure that makes all the difference when you're starting out in that career field. Students want to know because we're often talking with high school students, perhaps some undergraduate students as well. What can students be doing now to help prepare themselves for these types of careers, or maybe to help make themselves stand out when they're getting ready to apply to even undergraduate?
That's a really good question. Honestly, I didn't even know that the speech language pathology career existed until I got to college. So the fact that you guys are even here listening to this, you're many, many steps ahead of me when I was in college. I would just say, the important thing is to learn how to learn and to always stay curious about what's out there and to not second guess your ability. I was a pretty average student in high school, and I think I kind of second guessed my ability. And like looking back, I'm like, yeah, I could have been a physician's assistant or a physician even, but I think I doubted myself. And I would say to people, if you're passionate about doing something, then go for it, and don't let those little negative thoughts in your head keep you back. And the skies are the limit.
That's awesome. That's really good advice. Sometimes it's just as simple as like believing in yourself. And we hear often from our professionals that, it's about that tenacity and trying again. It's not going to be a road without failures, but to see how you deal with any failures or setbacks and continue on based on what your goals really are. So talk to me a little bit about how you got into the management role and maybe how that differs. That must look really different than your role as a speech therapist. What types of skills do you really utilize in that management role, and maybe what do you really enjoy about doing the management piece?
Yes. So I've been a speech language pathologist, as I said, for about 20 years, and I've only been in management for the last two. And if you think back to what started about 2 years ago, that was right when we had this thing called COVID and a global pandemic. So it was very interesting to not only have a shift in my career, but also do that with a whole lot of changes that happened to healthcare within that process. So, as a speech language pathologist in our undergraduate and graduate work, we have nothing on, business, management skills, anything like that. So, the majority of what you learn prior to coming into a role like this is just on the job. And I think most people don't go into management until they feel pretty confident, proficient in their career as a whole, because not only do you need to feel secure in your position, but it's going to take doing your current position concurrently with a new position in management. So there's a lot of new learning. So you have to feel really good with your basic skills as being a speech language pathologist. And also, the thing to know is when you're a manager in rehab, you're not just going to usually manage your own discipline. So I'm the manager of physical therapists, occupational therapists, and speech therapists. So those years of working as a multidisciplinary team member really got me to know, like, well, what does a PT do in a hospital setting? What does an OT do in a hospital setting? Because when you moved into management, you kind of need to know that. And there's lots of different nuances, and each discipline does things a little differently. But I think the biggest thing is you just have to be ready and open to learn, because you're definitely not going to know everything. And each day will bring its new challenge, and you just have to be ready to go for it.
Definitely. Can you maybe touch on that, what you've learned and what you know now about PT and OT? We might have students who aren't familiar with those disciplines, or maybe I think a big question is always, what's the difference between physical therapy and occupational therapy?
Yes. So, like speech language pathology, PT and OT are also going to have post-secondary approaches after your undergraduate. So, physical therapy is a DPT. So that's a doctor of physical therapy. So you do your undergrad and then you apply to PT school, which can also be a little bit competitive, but well worth it if that's what you want to do. And then same thing with occupational therapy. So my occupational therapist has a master's degree, but they are also moving to a doctorate of OT as well. So things are changing really fast with that. Speech language pathology is still a master's degree. We don't have a doctorate program unless you actually want to get your PhD. And then it's a 4-year program at a large university, where if you ever want to teach at the college level or do research, that's the approach you would want to take for that. The difference between PT and OT can be a little confusing. There are definitely some areas that they both share. Someone once told me that OT works more on the upper body, PT works more on the lower body. Not necessarily that simplistic, but let's delve into OT first. So OT works on activities of daily life. So in our setting, an OT would make sure people can brush their teeth, they can get dressed, they can take a shower, all those things that you have to be able to do to function from day to day. They also look at, can you cut your food? Some of the higher level things that OT works on are called independent activities of daily life. Can you drive? Can you do your bills? Could you manage your checkbook? Can you work in your job? There's also some subspecialties of occupational therapy. So some occupational therapists get additional schooling to become a hand therapist. So they literally just work with people that have maybe had surgery or trauma to the hands. So like with anything, you can be more of a generalist that does a little bit of everything. You can also be more of a specialist. OTs can also work in the school system. And I think a lot of those OTs may also work with children with disabilities, might work with children on the autism spectrum. And in that scenario, maybe they're working more on a sensory approach to things. So again, it is, I just touched a tiny bit on what's a huge field and a great field as well. Physical therapy works a lot on making sure that people are safe with their mobility. So in our situation, in a hospital setting, we make sure that people are safe to transfer in and out of bed. Can they even roll over in bed? Something simple like that we kind of take for granted. Can you get in and out of a chair? Can you safely walk up and down stairs? Can you walk the length of our hallway, or is your balance poor and you can't do that? So they work a lot on making sure you're safe with your mobility. And then, of course, again, it can expand into so many different things. One of my physical therapists is certified in dry needling. So people that have certain pain in their body, she can do this approach where she has a needle and a current that can kind of help with some pain areas. I've had it done and it's really, really cool. One of my other physical therapists is a lymphedema specialist. So she works with patients that are having issues with their lymph nodes, that their whole lymphatic system's not working right. So she has certain massage techniques and trains people in the use of compression stockings to make sure that their body's working as functionally as possible. Another huge part of PT is working with patients after maybe they got a hip replacement or a new knee, or any kind of new joint, or someone that had a fall. A lot of our elderly patients fall and have a hip fracture, and after that they need to learn how to follow maybe some of the precautions that they were given after their surgery, but also maybe how they need to do something a little bit different, how to get in and out of a car, in and out of bed a little bit different now that maybe you have that fracture. So again, I just touched a tiny bit on fields that could really go kind of sky's the limits. Some PTs work specifically on dizziness, and that's their entire caseload is working with people that have issues with dizziness with mobility. So again, you can be a generalist that kind of sees a little bit of everything, or there can be very, very specific areas that you can work in if that's your area of passion.
Definitely. And I guess my first thought is this still a growing area? Is there always a pretty good outlook as far as finding a job when you go into these fields?
I would say definitely. I mean, people are always going to be sick, and there's always gonna be people in the hospital, and there's always going to be people that need to care for them. I see the roles of rehab therapists like PTs, OT, speech just expanding even more. And it's a growing field. It would definitely be a secure field to go into if you wanted work. Some areas are more competitive to get jobs than others, just because, take for instance Madison. A lot of people really want to live in Madison, so it might be harder to find a full-time position in Madison. But in rural Wisconsin, there are lots of positions that we currently have open for OTs and PTs. So that's the nice opportunity is, working in rural America has some awesome benefits to it. And if people are more willing to, not live in those major hubs like Madison or Milwaukee, there's a lot of good opportunity waiting for you and more jobs.
Definitely. Well, students, we are going to be wrapping up here pretty quickly. So if there's any questions that we haven't answered yet, please put those into the chat. But Kelly, if you want to maybe just tell us, what do you like most about your job and maybe what is most challenging?
What I like the most about my job is just the fact that I work with people. I'm a people person. I'm an extrovert. I never really saw myself working at a desk job in a cubicle. And the beauty about being a speech language pathologist is every day looks different. And there's always a new challenge that it might bring. And it really is never boring. I also like that you work with lots of different disciplines. So in my everyday, I work with PT, OT, nursing. I work with doctors. I work with a dietitian. I work with social workers, nurses. So I love that it's a team approach and that we all work together to, just make sure that the patient gets the best quality care that they can get. The challenging part would be, you work in healthcare. You may not get off at Christmas when you want to. You may have to work some of those holidays, especially at the beginning when you're starting out with your career. Our hospital only doesn't see patients 2 times a year, and that's on Christmas and Thanksgiving. But other than that, they're seeing a therapist every single day for the rest of the year because the patients are here and they need to be seen. So taking that into account, especially, knowing when you're new, you may get more of those holidays than someone that's been there for 20 years.
Definitely. And you've kind of given us, the idea that every day is different. You work with a lot of different people. One of our students is wondering, what does a normal day look like for you?
I think a normal day of working as a therapist in a hospital is coming in pretty early, especially if you're a speech therapist and an OT, because a lot of times speech therapy, we work with patients who have trouble swallowing. So we might be seeing them while they're eating their breakfast, and here that's 7 o'clock in the morning. And our occupational therapists, again, they work with people on those activities of daily living. So they're in early because people are getting showered, they're brushing teeth, they're getting dressed. So your day could start pretty early, but then the benefit of that is you're usually done earlier in the afternoon too. Typically you would see 4 patients in the morning, maybe an 8, 9, 10, 11. You have a quick lunch, you're doing your documentation over lunch, and then you're seeing patients again for the afternoon, doing more documentation. Then that's your day. So it's on your feet a lot with those little breaks in between to do the documentation. We use an electronic medical record called Epic. That's come a long way too, and really is a great tool for ensuring that patients also get excellent care.
Wonderful. Yeah, that's a really good perspective of the different, scenarios that you'll come across and what it might feel like, all day long, and how your day will change from 1 hour to the next. So Students, I'm putting a link to a survey in the chat. We'd love to hear a little bit about how you feel today's session went and what you got from it. And Kelly, I'm really grateful for your time today and for you sharing your expertise with us. It's a really great field to get some perspective on, maybe not as, the typical career that students might be thinking of when they think healthcare. So it's just another great option for students who are looking at this as a potential career field. So thank you very much.
Of course.
Awesome. Have a great day, everyone. Thank you very much.
Bye-bye.